Do you have a friend who wants to know why he feels pain in his testicles? Testicular pain is one of the most common causes of consultation with urologists, both in the emergency room and in the consultation. And first of all, I would tell you that for you to be calm in most cases it is usually nothing. In any case, I am going to explain to you the 5 most common causes of testicular pain and what you have to do, how to differentiate them, what you have to do and what tests your doctor can perform. Let's go in order. First of all, the varicocele. What is varicocele? Varicocele is a varicose vein that affects the vein of the testicle so that this vein does not drain blood well and causes pain. It is something chronic. It usually affects people from the age of 20, 30, 40 and one of the things it causes is infertility. Secondly, orchitis, the infection in the testicle. It is much less common that varicocele usually affects older men, especially men from when they begin to have prostate problems 50-60 or also related to sexually transmitted diseases. It is characterized above all by very intense pain, increase in the size of the testicle and fever. The third cause would be the testicular tumor. Fortunately, it is a very unusual tumor that affects people over 30 to 40 years of age and the main symptom is a hard mass that is usually not painful and grows quickly. That is to say, it is something that takes place in days or weeks. If you have testicular pain that lasts for years, I can guarantee you that you do not have testicular pain due to a tumor. The fourth cause would be hydrocele. Hydrocele is when fluid accumulates when a kind of serum of water accumulates between 2 of the tunics of the testicle. It is closely related to orchitis with infection of the testicle and is usually identified as an increase in the volume of the scrotum that is not usually painful. In fifth place we have the torsion of the testicle. Along with testicular cancer, it is the second cause that is very important to know. Testicular torsion is when the testicle rotates on itself and this produces a testicular infarction. This always appears in young men under 30 years old, very usually under 20 years old, and is characterized by very intense pain associated with nausea, vomiting, and poor general condition. And the testicle is usually very retracted. If you find yourself in that situation, I recommend that you go to the doctor. As I mentioned at the beginning, testicle pain is extremely common. In the vast majority of cases we will not find anything. In any case, if you have testicular pain that lasts for a certain time, you should have an ultrasound. Ultrasound is what is called the gold standard in medicine. In other words, it is the test that best sees what is happening in the testicle. Many patients ask, I have testicle pain and I do an ultrasound and nothing shows up. Well, it could be. Just like the majority of men or women who have a headache and get a cranial tag done, nothing appears either. That doesn't mean you don't have pain. What it means is that this pain does not occur like any of the causes that I have mentioned. But the pain may be for other reasons that we cannot see on the ultrasound. But ultrasound is very important when it comes to ruling out these 5 causes that do have a specific treatment and if we know we can help you improve. Things you can do so that while you have testicle pain you feel better. Something that works very well is a scrotal jockstrap, which is a very fine way of saying tight briefs. Tight underwear will improve 99% of pain in the testicles. They will improve with that. The second thing I would tell you is the commonly used anti-inflammatories, such as ibuprofen, paracetamol, etc. And the third is the local cold. An ice pack wrapped in a cloth is never in direct contact with the skin because it burns, but rather in direct contact. That will improve the pain. Especially if you are going to play sports, wear tight underwear because that will make you have less pain. Especially impact sports, basketball, volleyball, things where you jump your testicle a lot. If it is not well supported, it can bother you more. Therefore, the 5 things that we have to take into account would be varicocele, which is varicose veins, orchitis, which is infection, testicular tumor, testicular torsion, and hydrocele. And remember that if you have testicle pain in the vast majority of cases it is nothing, but if the pain persists you should go to the doctor and do an ultrasound. I hope the video has been useful to you. Do you know that we have other videos about sexuality, andrology and urology on the channel? Thanks, bye. What's that?